First off, thanks to the organizers for the seminar series for inviting me to speak today. As already described, my name is Dan Gillis. My pronouns are he and him, and I am an associate professor and statistician in the School of Computer Science. As described, I do have several different research programs that include transdisciplinary pedagogy, bridging the digital divide, community engaged software design, and ecological and public health risk assessment. Well, these might seem very different from one another. I promise that they actually have quite a lot of overlap in a lot of really interesting ways. But for today, I'm going to be focusing in on sort of that public health component of one of my research programs. Okay, so before I get into the main part of the talk, I did want to acknowledge and thank the many people that I've had the fortune and privilege to work with and learn from over the past year. The folks who are listed here on the screen span several different departments and organizations, both on and off campus. It includes undergraduate students, master's students, PhD students, as well as faculty and other colleagues. And I should mention that while there are a lot of people listed here, not every person was involved in each of the projects that I'm going to talk about. And I'm not going to talk about every COVID-19 related project for which I've been involved over the past year. There was a ridiculous number of them, and it was a lot of hard work, but a lot of fun as well. I will, however, focus on a few of them because I think they demonstrate, again, the diversity of impact the pandemic has had on sort of research and life in general. We know that the pandemic hasn't simply opened up questions about public health and personal health, but also how we address human health, how we share information, how we collaborate with one another, and how a public health event might impact life in the short and in the long term. So again, I'm not necessarily going to be talking about every project that I was involved in, but I am going to sort of pepper in a few of them with focus on two in particular. So it's March today. It has been one full year since the World Health Organization declared the COVID-19 outbreak as a global pandemic. And it's almost been one full year since the University of Guelph also canceled face-to-face activities on campus in response to the pandemic. So 365 days have passed, and they all seem like basically that March 2020 hasn't ended. It's just been this ongoing weird existence that we've been living. But we know that a lot of different things have changed. The way we teach, the way we research, the way we're living and working, all of that has changed. And it's important to note that since that time, approximately 1 in 40 Canadians have tested positive for COVID-19. And of those who have tested positive, approximately 1 in 40 have died. Around the world, more than 2.6 million people have died. And that number doesn't really necessarily reflect the full scope of mortality associated with the pandemic. And those numbers are really, they're truly staggering. We also know that there's still a long road ahead of us until things return to normal, whatever normal happens to be. We know that there's going to be ongoing research to review and evaluate what's happened so far, how we responded, what worked and what didn't, how we can use what we've learned to improve our response for the next pandemic. And of course, there's going to be work as well to better understand the long-term impacts of COVID on health, wellness, the economy, the environment, and so many more things. It really demonstrates that this health event has had such a profound impact on everything. And it really sort of strengthens the idea of why a One Health approach is important to understanding human health. So even though we might be seeing the light at the end of the tunnel, thanks to the vaccines that we've got coming down the pipeline now, there's still a lot of work to be done. Unfortunately, none of that work is going to bring anybody back that we've lost. But the idea or the hope is that by understanding what's happened and using this One Health approach to the world, we'll be able to prevent further loss given any future pandemic that might happen and likely will happen. So as I mentioned previously, today I wanted to discuss several projects that I've been involved with and how each of them came to be. But to do that, we need to go back to March 13th, 2020, the day that the University of Guelph essentially shut down things, shut down campus in response to the pandemic. So I'm sure that everybody probably remembers where they were and maybe what they were doing and how they felt after the World Health Organization declared a global pandemic, and how close to home this actually felt when the University of Guelph shuttered everything and we moved to an emergency remote delivery for everything. For me, the story begins with sort of those feelings of uncertainty and dread, ultimately leading for me to some level of anxiety. And I'm sure many people were sort of in the same kind of boat. As a numbers person, whenever I'm feeling anxious, what I tend to do is I dive into data. So I began a search for data that I could analyze to model the data and better understand what was going on, potentially predicting new cases, new case counts, and that sort of thing. So I began documenting the work that I was doing, the collection of data that I was doing on my website. And ultimately through conversation with Dr. Teresa Bernardo, who's the IDEX chair in emerging technologies and preventive healthcare in the Department of Population Medicine in OVC. In our conversations, we started chatting with one another and realized we had some common interests and whatever. And so ultimately this led to the first of several collaborations with her and with Curtis Sobkowicz, who is a PhD candidate, also in the Department of Population Medicine in OVC. The goal of these collaborations, these early collaborations, were to share not only the data, but to share these analyses that we were all doing with the general public. Because at the time, if you remember back in March, really didn't understand what was going on. There was a lot of information going on in the news, but it was kind of hard to grasp necessarily what was happening. So we wanted to be able to do this because we knew people were hungry for information that was meaningful and in a way that was accessible to them. So this work ultimately led to the development of two different dashboards, one particularly for looking at COVID-19 in Canada and another one for looking at COVID-19 globally. It also led to a short publication, which I'll talk about in a bit, with the Canadian Science Policy Centre on the need for better data. And I think that's one of the takeaways that I've pulled out of the experiences over the last year related to the pandemic. Okay, so as as the spring started to wane and we moved into the summer, at that point in time, I was a PhD student, Melissa McKay, who's in the Department of Population Medicine, contacted me because she was working on some research related to her PhD, and she wanted to talk to me about it. Specifically, she was investigating the perception of crisis communication via social media, and obviously really important at this point in time, given the misinformation and disinformation that was perpetuating in social media, thanks in part to government officials who believed the pandemic was a hoax and that sort of thing. So this provided the opportunity, when her and I were chatting, it ultimately provided the opportunity for students in the Ontario Vet College and the School of Computer Science and the School of Engineering to work together to basically collect some data, analyze it, and basically understand what was happening in social media. I won't be talking about that particular project in great detail. I will touch on it a little bit in a few minutes. But I did want to say that Melissa has submitted the findings to this work for peer review, and I'm looking forward to that getting released, but I don't want to spoil everything related to her work. So I will touch on it, but I'm not going to get into great detail there. I do mention this work, however, which was sponsored through the University of Guelph's COVID Research Development and Catalyst Fund, and supervised by Dr. Andy Papadopoulos. I mention it because it demonstrates the diversity of research that was happening related to COVID-19, and again, to reemphasized the idea that this health event was not limited to just sort of epidemiological type studies. There was so much more going on. And again, it shows the diversity of what happens in a, like why One Health is important, because there's so many diverse things happening and so many voices that need to come together to understand what's happening and to mitigate and get us through the pandemic. I also received funding around this time as well from the University of Guelph's COVID Research Development and Catalyst Fund. And this was basically to support the creation of an environmental agent-based model. And the idea there was to evaluate different mitigation strategies given different scenarios related to the pandemic. And while this analysis, this type of scenario analysis is ongoing, I will spend a bit more time later talking exactly about what this project is about and where we are at the moment with it. Finally, as the summer sort of turned into the fall, and given much of the work that Dr. Bernardo and I had done together and separately, she approached me and Curtis Sobkowicz with the idea of essentially turning what we had learned since the onset of the pandemic into a paper. In particular, she had realized that there's a need to document all of the things that were happening from a collaboration point of view. And we witnessed in all the work that we had collected, and Teresa had collected a lot of information. We witnessed a lot of different types of collaboration, both within academia, but also outside of academia, with government, business, industry, citizen scientists, and so on. So the team soon was expanded to include Russell Forrest, a graduate student at OVC, Luke Stewart, DVM student, and Marcello D'Agostino and Enrique Gutierrez. I think I messed their names up, I apologize. Both of them with the Pan American Health Organization and the World Health Organization Regional Office for the Americas in Washington, DC. And interestingly enough, this team she brought together just to sort of demonstrate how weird this life we've been living in over the last year has been. This team she ended up bringing together to talk about collaboration was a team that had never and still has not been in the same room together. So it sort of speaks to the idea of how we've come up with new ways of collaborating because of the impact of the pandemic. So over the fall semester, we worked together to pull together as many collaborations as possible that were documented in the news, on social media, in journals, basically wherever we could find them. And the projects ended up spanning numerous disciplines, but they didn't have to be academic in nature. And it included works related to PPE, ventilators, DNA sequencing, contact tracing, dashboards, data collection, citizen scientists, vaccine development. Basically anything was open for inclusion in this sort of collection of collaborative works. This particular paper was just recently published in JMIR's Public Health and Surveillance as of February 8th. And I think the overarching sort of theme, I think, of the paper outside of collaboration is like, it's a positive one. So despite all the awfulness that's happened over the last year, there is a lot of really positive things that have come out of this pandemic that, you know, I hope we carry that energy with us to address other big challenges. And I think as a sort of a representation of this need for people to maybe hold on to something positive, the paper since February 8th and up to March 6th has been viewed already more than 1,250 times, which I thought was pretty wild. I don't think any of my stats papers have ever been like that. So I'm going to spend some time today talking about this particular project as well, assuming I don't go over time, and making sure I give you guys time to ask questions. So this all brings us today, which is the anniversary of the declaration of COVID-19 as a global pandemic by the World Health Organization. And you might have seen this in the news earlier this week, but to recognize the year that has passed and the challenges we faced and the lives we've lost, Prime Minister Trudeau basically stated this week that today would be declared the National Day of Observance for COVID-19. And I think that it's so important to recognize this because the past year has been unlike anything that we've ever faced. It has been devastating and life-changing in many ways. But as I discuss some of the projects in more detail, and as you think of your own experiences, I hope you also look back on this year with a sense of hope, and at what is possible when we work together. And as I mentioned previously, we use this energy and take it forward to address some of the many big challenges we have today: hunger, poverty, climate change, biodiversity loss. These are big challenges, but we've demonstrated over this last year that when we collaborate effectively, we can do a lot of really good things. So however you recognize today, I hope you end up recognizing it with some sense of peace and hope, especially given the vaccines that are getting into people's arms now. Okay, so let's begin with data and dashboards, because this is, again, the start of the story that started the story of COVID-19 for me and my experience. So as mentioned early on in the pandemic, I turned to data to manage my anxieties about what was going on. And as I said, this led to a collaboration with Dr. Teresa Bernardo and Curtis Sobkowicz and the creation of the Monitoring COVID-19 in Canada dashboard. The dashboard, you can access, the link is there. I'll make these slides available on my website in case anybody wants to get access to these different links. The website, the dashboard, was created to basically give basic information about the pandemic, particularly early on in the pandemic. And we wanted to do it in a way that was accessible to the general public. So while we included various different epidemiological curves, we also worked to provide easy to understand interpretations for those who might not be familiar with epi jargon. Of course, during this process of uncovering, of collecting data and trying to plot it, we uncovered a lot of challenges with data. Specifically, the data associated with the pandemic were incomplete, inaccessible, and inconsistent. In fact, at one point in time, the Ontario data was, basically we were able to identify that the Ontario data that was published was wrong because data that were coming out of Johns Hopkins, there was a discrepancy. And the saddest part about this is that Johns Hopkins was correct and our government numbers were wrong. And so this gives you a sense of some of the challenges that we were facing. And it was only made worse by backlogs and changes to how testing was being performed and evaluated across Canada and in the province. And the fact that different agencies reported data in different ways, everything was like constantly changing. At times data were presented in aggregate forms with no socioeconomic, age, gender, race variables, or any other types of variables that you would typically see in an epidemiological study. There was no information provided about the status of cases initially, so we didn't know if people were in the hospital, if they were quarantining, if they were on ventilator, if they had, there was so little information at the beginning. And that is understandable because nobody knew what was going on. It was a pandemic, things were, crazy. So as the pandemic progressed, data changed as well, and the type and the format of the data that were available to us changed. And we actually ended up using at one point in time the Wayback Machine to sort of document all of these changes. And it's interesting to see some of the changes that had occurred and how incomplete or inconsistent the data were as things were changing. So you can imagine that this had a huge impact on our ability to create this dashboard. Essentially, if you wanted to track the pandemic, in early stages, you either had to track the data manually and create your own spreadsheets, or you had to use web scraping tools or the Wayback Machine to collect the data so that you could actually analyze it and try to understand what was going on. Over time, changes in the data quality and consistency were made in order to better serve Canadians who wanted this information, but it doesn't mean that things were simple. We still had to, over several different times, basically had to update our code, our source code for generating these plots, because the data structures changed in some fashion because there were no standards applied to how the data were being saved or managed. And so sometimes this included data type, like data being the name of the data column changing, and we're not knowing what needed to be downloaded because we didn't know that change had happened, or extra data being added. So things were constantly in flux, and it made things very difficult. Ultimately, what we learned in all of this was that our pandemic response in Canada, particularly related to data, it needs to be updated. We desperately need standards, I think, for how data are to be presented, including naming conventions, the types of data that are going to be collected and made available. The plan that we currently have isn't terribly old. It was last reviewed, I believe, in 2015, but tech moves extremely fast. So the data we have available to us now is different in scope, quality, and quantity than what we even had 5 years ago. So we need to update this based on these challenges, because with good data, we can make better decisions and potentially save lives. So we documented some of these issues and some of our thoughts in a publication hosted by the Canadian Science Policy Centre. And that's also linked at the bottom of the screen here. But again, I'll post this on my website later. The next project that I talked about was the social media messaging. And this is with Melissa McKay in OVC. And she began by identifying principles that could or should guide social media messaging, particularly from a public health point of view. These included things like how the message is being told, the transparency level, and so on and so forth. Once that was identified, Melissa worked with an MPH student named Taylor, I'm probably going to mess up Taylor's last name, Colangeli, to basically extract a whole bunch of social media posts from media, from the Canadian media, and from public health, and then also the replies that people had made. And the idea there, the posts were pulled so that they could then be sort of matched with the guiding principles for creating good messaging in social media. And then Taylor and Daniel Mill, a computer engineering student, worked together to process these posts to understand the overarching sentiment displayed in each of the comments to the posts that were made, either negative or positive. And those were then analyzed to determine potential relationship between the type of organization, media or public health, posting, and then the sentiment exhibited. And then we also explored the sentiment change, how the sentiment, or whether the sentiment changed given the different guiding principles used. The goal ultimately of this particular work, and it's ongoing, it's part of her PhD research, is to provide folks responsible for public health communication with a set of evidence-based guidelines to how to present information, particularly information in during a time of crisis. Some of the high-level findings from this work so far include that the sentiment was largely negative across all sources, public health or media, as well as the fact that none of the sources consistently or widely applied the guiding principles for even sharing messaging. And clearly this is problematic because particularly at a time of crisis when information is so important. So Melissa's continuing to investigate this phenomenon because it's really important as we're trying to manage the pandemic to make sure the messaging, the public health messaging that we're getting out there is appropriate and being absorbed in the right way. So that was the second project. The next project, and I'll try to go into a little bit more detail on this one before I get to the final one, is scenario analysis. And so during the work that I had with Melissa, I was also fortunate to obtain funding, as I mentioned, through U of Guelph's COVID Research Development and Catalyst Fund. And the funding, along with subsidies provided through, and I'm going to have to read this because it's long. The funding and further subsidies provided through the Work Integrated Learning Digital Subsidy Program offered through the Internet Communications and Technology Council of Canada via the Government of Canada's Student Work Placement Program were used to hire several different co-op students from School of Computer Science and from the School of Engineering. 9 students were ultimately hired, 4 of them working on this particular project, including Joyce Lee, Daniel Medmood from School of Engineering, and James Bush and Eric Morgan from the School of Computer Science. The ultimate goal of this work was to evaluate the impact of mitigation measures given further pandemic waves and under various different plausible scenarios of our future. So what does that actually mean? So let me sort of take a step back and explain what scenario analysis is in a nutshell. So for those of you who have ever asked what if, or you've envisioned a scenario, what would you do in this situation? You're essentially on the track of scenario analysis. Scenario analysis is a method to evaluate potential futures given the data we have on hand now. The data may be qualitative or quantitative and can include expert opinion, lived experience, and so on. And the goal is not to predict a specific outcome per se. It's not to say that in this situation, we're going to see 20% of people die or something like that. It's to be able to take a look at what we have now and look at the relative change between plausible futures, so that we can perhaps identify futures that look brighter, if you will, and also to be able to identify signposts that tell us that we're on the track to this particular future. The idea being that if we see a signpost early enough, we can change our direction and adjust our strategies so that we go towards the future that we want. I've been involved with this work in the past with the Public Health Agency of Canada related to the H1N1 outbreak, and also with polio and childhood obesity. It's a fascinating process. I'm going to give sort of a gloss over of what we've done so far, because I want to make sure we have time for questions. So the first task of the students was essentially to create a database of information. And so they reviewed the available academic and non-academic literature to collect data related to the pandemic. This included typical things you would think of, like case counts, demographic information, hospitalization, ICU, and mortality rates, and more. And they were also tasked with collecting information on, for our study, the city of Guelph, so that we could get information on the people who live here, where they explicitly live, not down to their houses or anything like that, but just in general, what neighborhoods look like, as well as the things that people normally do when they aren't burdened by a global pandemic. So they were getting things like transit routes and all that kind of stuff. Once they did that, they began the process of evaluating the available data and using this to develop an agent-based model that would describe the geographic and temporal movement of citizens of Guelph as they went about their business each and every day. And the idea being is that once we had this created, we could drop an individual who had COVID-19 into this population and see what happened. Ultimately, the goal is to create something realistic enough to determine how COVID-19 might spread in the community. I mean, we already know from living it what that looks like, but then we can use that and other data to sort of evaluate how different mitigation strategies might affect the spread of disease and hospitalization, ICU, and mortality rates. And then layer on top of that plausible scenarios. For example, what might have happened if a vaccine were present, but we didn't receive significant uptake because of pervasive anti-vaxxer sentiment? Or what might happen, or what could have happened last fall if our flu season was significantly worse than normal, which fortunately for us, the use of the mitigation measures we had seems to have prevented the flu season from being anywhere close to normal in a very good way. So ultimately, this is the idea. But what is an agent-based model? So in a nutshell, the model essentially takes, it's a simulation where every single agent in the model represents an individual animal or a human in our population. And so it's a large computer simulation where essentially we create each of the individuals, we give each of those individuals parameters that describe their age, their gender, any other factors that might be relevant, socioeconomic status, where they live, the types of things they're doing, such as going to work, going to school, that sort of thing. And we basically create this, if you've played Sim Life or any of those sim games, it's that, but once we start the simulation running, we're not really doing anything with the individuals there other than watching what's happening. So once this is created, then we drop in an individual who has COVID or several people with COVID, and we include things that, such as, different risk levels associated with age groups or socioeconomic status or gender or whatever kind of data we might have. We assign risks to not just the exposure of COVID, but the contraction of COVID, whether or not COVID becomes more severe and you're hospitalized or sent to ICU or ultimately die from it. And the goal here is then to overlay, as I said, the different scenarios on top of that to determine what might happen if we introduce mitigation measures in different ways, and what might happen if other things are happening that have an impact on the community, such as an increased flu season or anti-vaxxers or whatever it happens to be. So what have we got so far? Well, to be continued, really. Well, I'd hope to be able to show some of the outputs for the model. We aren't quite there yet. While we've run some of these analyses and such, I'm not at a state yet where I want to present the actual results. What we're seeing so far is interesting, but we still need to go back and validate things. And because of the work that Melissa was doing, specifically related to social media and the spread of mis and disinformation, I really don't want to post anything about what we're seeing so far, in the fear that the information is actually seen as more significant than it is. So hopefully over the next semester, we'll be able to start pumping out more of those results, which I'll initially probably share on my website. And then we'll launch a user interface that people can play around with and sort of start their own pandemics and see what happens under different mitigation strategies. So currently the team's working to update the parameterization of the model so that it creates a pandemic that looks real city of Guelph. And once that's finished, then, as I said, we'll publish some of these results. But it's pretty cool so far. But again, I don't want to share specific images yet, just until I've got a chance to validate them. I was hoping to have it done for today, but has not happened. The good news too with this model, like you might be wondering, like, why am I still doing this, considering we've got the vaccines on the go, and we may be seeing a third wave. But hopefully we'll get through that quickly because of the vaccine and whatnot. So why are we still doing this? The good news is that this model, the students have designed it in such a way that it can be updated in the event that we have another pandemic, and to understand, and we can probably apply other things to this sort of scenario analysis, and to this simulated Guelph, right? I see a person has their hand up. Amir, did you have a question?
Yes, sir. Is this a college class?
Pardon me?
Is this a college class?
No, this was students that were hired, co-op students that were hired, that worked on this last summer, and there's been a couple that have worked on it last fall and continue this semester. Although that would be a fun course.
Yeah, it would. It really would be.
Okay, so yeah, so I'll leave the scenario analysis because I do want to get into this final paper, and then I'll go through that a little bit quickly so that I can open it up to more questions. So the last project that I talked about, and the one that I want to finish on, is related to the ultimately collaboration in general, and the work that I started off with Teresa and Curtis so early in the pandemic. And the reason I want to end off on this one is because I'm hoping that it's going to leave you with the idea that it's not all bad news. It's been a trying year, but there's a lot to be positive about. In fact, the scope of collaboration and the amount of stuff that's been accomplished in the last year is so remarkable that I believe it, as I mentioned previously, it speaks to our capacity to address really big issues. And again, this work is in partnership with Teresa Bernardo, Curtis Sobkowicz, Russell Forrest, Luke Stewart, Marcelo D'Agostino, and Enrique Gutierrez. Again, I think I butchered that name, I apologize. And ultimately what we did is we scoured the internet, we scoured the journals, we scoured basically any source of information that we could find in order to collect any information, any projects out there that had to do with collaboration. And after we sort of collated all of this information, then we started piecing it apart, classifying it under some broader headings. And those headings included data, physical hardware, crowdsourcing, artificial intelligence, and knowledge dissemination. As I mentioned earlier in the talk, the issues that we saw initially with data, it was all on sort of the negative side of things. However, what happened as we were collecting information on collaboration is we soon learned that there were a lot of data projects going on that helped. It wasn't a negative thing, right? So this included folks from the University of Toronto, University of Guelph, and Sick Kids researchers creating a repository of data. And in fact, there were folks that were going through media, just newspapers and such, to get information on cases, such as the gender and age of individuals who were in the hospital and who died. That's how little information we had at the time. And that was made available to anybody that wanted to use it. Hawkins then created their dashboard and data sources and made those available. I think it was in January, if I remember correctly, when China basically gave the world the genomic data related to the COVID-19, the virus that causes COVID-19. We also saw at this time crowdsourcing, where industry was coming together and creating hackathons to get people to come together and solve some problems. And this led to the development of contact and tracing apps. It led to, for example, a student in Washington creating a website to track the disease because people wanted this information. There was so much collaboration happening at this time that ultimately we ended up trying to document it as best we could in this paper. I'm not going to get into the specifics of all the details in here. I'll leave that to questions if you have any, just because of the time. But again, the takeaway from all of this is, I think the takeaway that I want to leave you with is something that we state at the end of the paper. And I'm going to read this because I think this is sort of a nice way to sum up everything that's been happening. So collaboration, co-creation, and networking that weaved throughout the pandemic response needs to be recognized as more than a series of random events. We have learned to adapt on the fly, incorporating nimbleness and agility into scientific endeavors. New ways of working together, exemplified by the surge in video conferencing, have been thrust upon us, but will have ramifications that last beyond the current pandemic. Our connectedness has allowed us to dynamically share and magnify information about the pandemic, regardless of its reliability. And I think what's really great about this is that it has shown us the power of collaboration. And I believe we need to fully embrace this to address future challenges, or well, even current and future challenges, future pandemics, things like poverty, hunger, the big challenges that we currently face. I think COVID has shown us that we have the capacity to do that if we just put our mind and our money and our time towards it. And the last thing I'll mention is, and again, this is another bright light, hopefully for those of you who are still in, are suffering through pandemic malaise or whatever you want to call it. It's exciting to see that the University of Guelph has opened up or is opening up this clinic for COVID-19 vaccinations. I think it's another positive story and another one that speaks to the power of collaboration. So I'll end it there. Finally, just saying, please stay safe, mask up, physically distance, stay home if you can until this is all said and done. We're not out of it yet, but we're almost there. So thank you, and I'll open it up to questions now. Catherine.
Hi, I would turn on my video because I know how hard it is to give talks while you're looking at a sea of black screens. But anyway, thank you so much for such an interesting talk. And wow, you've been busy during this pandemic. I was so impressed.
I'm tired.
I bet. My question had to do with, and maybe this is revealing too much of the data that you're uncovering now that you're feeling uncomfortable with, or feeling uncomfortable revealing at this point. But how, from your look at the data, what are you thinking in terms of the emergence, the very strong emergence in Ontario right now of the new variants and the possibility that we're going to have to do a third lockdown?
I am leaning towards we are going to have to do another lockdown because, again, I think part of it is people, like, it's spring outside, people want to get outside, they want to do things. I don't necessarily think that our lockdowns have been as effective as they could be. So based on the data that I'm seeing, I do think we're going to have another lockdown. I'm hopeful that it'll be short-lived simply because of the vaccinations that are slowly getting into people's arms. But it does concern, I do think we're going to have another lockdown, unfortunately.
Thanks.
Yeah, no problem. Even with numbers decreasing and vaccinations up. So the numbers have sort of leveled off and might be ticking upwards in Ontario. Vaccinations are going up. I just don't know whether or not the amount that the vaccinations are going up if it's quick enough at this point in time to offset this plateau and possibly increasing of numbers. The other thing is that it does, the last time I looked, it does seem like the variant is sort of gaining a bit of steam. So I'm hoping that, I'm hopeful that vaccinations will get ahead of it, but I do think that we might have to go into a lockdown again. I hate saying that, but I do think it might be the thing that we have to do. There's still a lot of positive stuff, though, a lot of good things that are happening. So I want you to take that away mostly from this, because I'm predicting based on always incomplete data. So fingers crossed that I'm wrong. This is a case where I want to be wrong desperately. A lockdown? Oh, no clue as to when. I've heard others talk about the idea of, within the next few weeks, but again, it's really going to depend on, I think, what happens with the variant and whether or not it does get significant traction. But and then it's also going to be weighed against the number of vaccinations that are out there. So I don't know when it could happen. But it's just sort of my take on what I'm seeing in the data. So, but again, I hope I'm wrong. I want to be wrong. Catherine, did you have another question?
I do. I had a question about the collaborations, because I agree with you. I mean, historians generally are very solo-based researchers, but I've seen more move towards collaboration, even on sort of my side of the academic world, which is really, I think, it's time and it's very encouraging. But I'm wondering, I've been reading quite a bit lately about sort of what the mental health impacts of COVID have been. And, they're not as pronounced as maybe one might expect. And some of the theory around that is that, people are pulling together because it's a pandemic, right? And so there's a sense of we're all in this together. And that may have mitigated some of the mental health issues. Obviously it's highly variable by individual. But I was wondering if you thought that the sort of focus on collaboration, will it be just a response to COVID and then disappear when we get into regular times? Or do you think that this is something that's going to last?
I really hope it lasts. From the experiences that I've had with Dr. Shoshana Jacobs in the Icon classroom, seeing what can happen when these different disciplines get together and start trying to address challenges, big or small. I feel very, very strongly that collaboration is the only way that we're going to address big challenges, because none of these, like COVID, poverty, hunger, climate change, biodiversity loss, none of these things are housed in any single discipline, because they affect, it's a system-wide thing, right? Like COVID, as sort of hopefully demonstrated through my talk, COVID has impacted so many different things. Like there's so many questions about COVID, and they're going to continue after this. Some of the projects that I didn't talk about were things like, how has COVID impacted the way we teach? And obviously we know that's a huge change, and how is that going to go forward and whatnot. But we're also looking at things like, how has COVID affected, or how might COVID affect those who have access to the university system, what that might look like in the future. So there's so many things that are going on, and so many changes that COVID has affected, and any of these big things are going to have massive effects outside of any single discipline. So I think in order for us to actually address them and solve them, or at least mitigate their impacts, we absolutely have to collaborate more. I hope that this has taught us the power of collaboration. I hope it encourages faculty to cross disciplinary boundaries more than they've been even doing in the past. I hope it gets faculty out into the community to understand what the real in the moment challenges are right now, and see if we can help out to see what we can learn from our community. So I'm really hopeful that it's something that becomes the norm, and that we start teaching how to be collaborative. But we'll see.
Unfortunately, we are out of time, and I think that's a bit of a nice hopeful note to end on, that hopefully this collaboration definitely continues post-pandemic. I would definitely like to thank you, Dr. Dan Gillis, for speaking today, for a really interesting and thought-provoking presentation. I really enjoyed it. I hope everybody else enjoyed it as much as I did. So thank you again, Dan, for joining us. And thank you, everybody who joined in today. And we hope to see you again in 2 weeks. Have a great rest of your day.
Great. Thanks, everyone. Thank you.